In studio with me, I have Laurie Lake from the Children's Institute in Cape Town. She'll be chatting to us today about a series of children and COVID-19 advocacy briefs, which focuses on how COVID has impacted children's healthcare, education, early childhood development, nutrition, mental health and exposure to violence. And it calls on government to put children at the centre of South Africa's COVID-19 response and recovery plans. Now, these advocacy briefs were developed by the Children's Institute at the University of Cape Town in collaboration with the Children's Hospital Trust and the Michael and Susan Dell Foundation. Today and in the next week, we will be featuring a number of authors of these briefs, but Laurie is here today to talk about the overarching theme of this series. Laurie, thank you so much for joining us and welcome to the show.
It's a pleasure.
You've been on RX Radio before, so it's great to have you back. But for those listeners who don't know, can you please tell us a bit more about yourself and what it is you do?
I'm a communication and education specialist. I work at the Children's Institute at the University of Cape Town, and I do three things there. The one is I put together a book about children called the South African Child Gauge, and that's designed to measure progress for children year on year. The second thing I do is I'm involved in our child rights teaching. So we teach doctors, nurses, social workers about children's rights so that we can start to improve healthcare services for children. And then the third thing that I'm involved in is the advocacy committee within the Department of Pediatrics and Child Health. And very, very early on in the pandemic, we were concerned about children and the ways in which children were being left behind. So really the advocacy briefs comes out of a series of very deep conversations that we've had over the last year and a half.
So these briefs, they've come about as a result of those initial concerns that you were having?
Yeah, even before we went into lockdown, we were thinking about what is the impact going to be on children. And one of the concerns is that COVID is generally considered to be an adult disease. They're more likely to get severe infection, they're more likely to die than children. So in a sense, government's response quite rightly has focused on adults. But that's meant that we've been blind to the impacts, the many, many impacts that COVID-19 has had on children.
So for the listeners, and for me, talk a bit about the impacts that COVID-19 has had and the lockdown, what impacts that has had on children.
Okay, so maybe I'll start with so we have a series of 7 advocacy briefs, and the first one is really looking at what we've called COVID care and a call for child-centred COVID care. So if you imagine a child who is infected with COVID, how do we respond to that child in a way that not only addresses the medical symptoms, but also addresses the child's need for information, for reassurance, for family care? So there was a lot of concerns early on around decisions to separate, for example, mothers and their newborn babies, because there was a concern that infections would spread within neonatal wards. So there was a lot of advocacy that took place within the Western Cape, within the country, within the child health community globally, to advocate for children and their families to be kept together or to maintain contact so that children have support at a very frightening and distressing time of their lives. So we need to think about children even when we're thinking about COVID-specific care. We need to think about children who may be left behind when an adult is infected with COVID. So are we asking questions when an adult goes into hospital? Are there any children at home in need of care and protection? So again, putting children at the heart of our COVID care response. Then we know that because we were so focused on adult COVID care, that lots of resources got diverted from child health to adult care. We needed to do all the social distancing to prevent infection, and routine healthcare services for children, such as immunisation, really suffered, particularly in harsh lockdown. So again, a need or call on government to prioritise those routine health services, because otherwise we're going to look at a whole series of problems that will impact on children's health for a long time to come. So things like measles, which can be prevented through immunisation, things like HIV, TB, all those children need access to testing and to treatment. So that would be a second area. And then we know, as you said, that lockdown had a tremendous impact on the economy, on people's livelihoods. We've seen a massive rise in unemployment, in hunger. And we've also seen how families have tried to protect their children from hunger. So the rates of adult hunger in a household have been higher than that of children. But we're still looking at 1 in 7 households where a child went hungry in the last week. And that's before the COVID-19 Social Relief of Distress grant was removed. So there are very serious concerns about children's nutrition moving forward, and what that means for something like stunting, which impacts not just on children's nutritional status, but on their learning and their chances of finding a good job at the end of school. So that's nutrition. We were concerned also about violence and injury, with everyone trapped at home, parents under a lot of pressure and stress, and a concern that would spill over into conflict in the family. And also a concern linked to that children couldn't access their normal support systems, whether that was extended family, friends, schools, teachers, as well as child protection services. So one of the briefs focuses on violence. And I suppose one of the things that also comes out of the brief is that we don't always have access to all the information we need. So we know how many children came to seek care at Red Cross Children's Hospital. And what we've actually seen over the last year is a decrease in both accidental and non-accidental injuries. But we don't know what was actually happening in children's homes and communities. So is the decrease a real decrease? Did things really get better under COVID? We think not, based on what we know about the patterns of violence. But we don't have measures at community level to understand what's going on.
So it sounds like there's a wide ranging set of things that these briefs are going to be dealing with.
Yeah.
If people want to find out more about them, where can they? If they want to follow the progress and if they want to check out the briefs, that sort of thing.
The briefs are going to be up on the Children's Institute website, so that's www.ci.uct.ac.za. So they'll be up on the website from Tuesday. We launch the briefs, so they go live on Tuesday morning, and you can access a link to the event on the CI website. And there are going to be a whole series of great speakers talking about the importance of children and really calling on government to step up our response. And really that's what the briefs are for. We've called them advocacy briefs because they're talking not just about the evidence of what has happened so far, but we're wanting to give people a tool to really push for change for children. Whether it's a doctor or a nurse working in a clinic, or a school teacher, or children themselves, to provide that evidence of what we know so far. And so for us, it's really a start of a conversation rather than the end of a process.
Awesome, Laurie. Thank you so much for joining us. We'll make sure that information is also available on our social media networks. Thanks so much.
It's a pleasure.
You are listening to RX Radio.
For and by children.
RX Radio. RX Radio rocks.